Hi guys, welcome back to our channel, and today we are going to talk about melasma.
So melasma is a very common skin problem seen commonly in brown skin. It presents as brown to grey patches usually on the sun exposed parts such as the cheeks, the forehead, above the eyebrows, above your lips. It can also be present on the neck and forearms if you have a lot of sun exposure.
Melasma usually affects women, but it can also affect men. What is happening is that the melanocytes, or the color producing cells, are increasing the production of black and brown pigment in the skin.
The main cause of melasma is sun exposure. That is why melasma worsens in summers and you see it decreasing in winters. Also, sun exposure is the commonest reason why people get melasma time and again.
Apart from sun, melasma can also be due to hormones, especially starts during the pregnancy, or it can also start in people who are taking OCP pills.
Also, it can happen in men who are on hormonal pills for things like prostate cancer. They can also develop melasma, so it is quite related to the hormones that you have. Other than that, there are other reasons of melasma, such as the LED bulbs, the blue light that is emitted from the phone screens, mobile screens, the laptops, that is known to cause melasma as well, which brings in the role of sun protection in melasma.
Right.
Yeah. And there are other things such as genetics. If you have a family history of melasma, you are more prone to develop melasma in your adulthood.
Also, few cosmetic products and abnormal thyroid levels can cause melasma. I'm commonly asked if food affects melasma. Well, there are no studies that show a specific food which can increase or decrease melasma.
So melasma can be diagnosed by simply looking at your skin. Your dermatologist can simply examine and tell you that you have melasma. However, in certain cases, they can do a test called Wood's lamp examination, or they can use a dermoscope to look at your melasma to know the depth of pigmentation. This helps in determining the treatment plan. Also, in certain cases, there could be a confusion in the diagnosis, especially with things like exogenous ochronosis or with nevus of Ota, where there are like moles in your skin. In that case, your doctor can ask for a skin biopsy to help you diagnose melasma.
If there is an inciting cause to melasma, like pregnancy, taking OCP pills, once we stop these causes, the melasma might fade away on its own.
But having said that, for most people, melasma is a chronic, recurring condition that always comes back.
The most important aspect of treating melasma is protecting it from UV radiation by the use of a good sunscreen. Look for tinted sunscreen which have iron oxide in them that gives protection even from the visible light.
Ideally, we suggest you to use SPF of 30 to a minimum. You can also try SPF 50, a PA factor of 3+, that gives you protection from both UVA and UVB radiations. Try wearing physical protectants like broad-brimmed hats or full-sleeved clothing to prevent yourself from melasma. A lot of people also ask me, is it important to wear sunscreen indoors? So what do you tell your patients about that?
Of course, with this so much use of mobile phones and laptops, it's must that we use a sunscreen indoors, and again a sunscreen which has visible light protection, that is with iron oxide, works well for this.
You can also try looking for agents such as zinc oxide or titanium dioxide, which are also mineral sunscreens, and they're more helpful in melasma than chemical sunscreens.
Right. Melasma is best treated with prescription medicines. So take a trip down to your dermatologist's office. So hydroquinone is the main treatment for melasma. I like to switch to more safer treatment options later because hydroquinone can cause permanent damage to the skin if applied for a long time, and if you're taking hydroquinone, it must be under a prescription of a dermatologist.
Right. Do you also combine it with certain other agents? Or do you give it as a standalone therapy?
So melasma is a multifactorial disease, so we should use multiple different modalities to treat it. Hydroquinone forms a depigmenting therapy. Then we should add an exfoliating agent like a retinol or a retinoid, and also of course sunscreen we have to continue.
Right. After hitting hard initially to treat melasma, I generally shift to safer options that are good for your skin in long run, such as azelaic acid or kojic acid. I also tend to give antioxidants such as vitamin C or vitamin E to apply. This prevents darkening of your skin because darkening happens primarily because of oxidation. But these have to be used along with the sunscreen.
Lately, which is a very safe molecule and a good substitute for hydroquinone, has produced great results in my patients. So that is my go-to molecule these days. So what about tranexamic acid? How do you prefer to give it, oral, topical?
So the efficacy of oral tranexamic acid is quite determined in the studies. So that is what I generally tend to give in patients who have resistant melasma or who have such severe melasma that it's affecting their emotional or mental health. In that case, I try to treat with oral treatments in the initial phase as well. Coming to topical tranexamic acid, unfortunately the studies are still not established about its efficacy. So I tend to give it as a last resort when nothing else is working.
Right. So tranexamic acid, again a prescription grade medicine, and should not be taken by patients who are having lipid abnormalities or cardiac problems. Now there are many procedures that we can do in clinic to decrease melasma, and the top one I feel is chemical peels. It has given consistent results in almost all our melasma patients.
So what are your favorite chemical peels and which ones do you prefer in the initial phase of therapy?
So to start with, I start with exfoliating peels which cause actual exfoliation, like a yellow peel or a TCA peel, and then slowly I go to peels that work more on the depigmentation. And after 6 to 9 sittings of chemical peels, we can expect a significant reduction in melasma. Of course, use of sunscreen is non-negotiable.
Few of my favorite peels are phytic acid peels, azelaic acid, mandelic acid peel. I also love glycolic acid peel. I slowly start with 30% to moving up to 50 and then to even 70% of glycolic acid. And how often do you perform chemical peels though?
So usually I do chemical peels every 15 days and then monthly for maintenance. What are the other procedures that you feel work well for melasma?
So I also tend to try physical exfoliation such as microdermabrasion, or we can go to dermabrasion if the patient is really fair skinned. In that case it gives good results, and we can also try some laser therapies or light based devices to treat melasma.
But some of the very aggressive therapies can actually stimulate the melanocytes or the color producing cells to increase melanin production and can actually worsen melasma. So it's best that you go to an experienced doctor to have best results when it comes to melasma.
Do you also try injectables when it comes to melasma, some injections that you might have tried?
So we did a study back in the college where we gave tranexamic acid and glutathione to patients who had melasma, and there was a significant reduction in both the treatment groups. So injectables do work.
Right. So it could be a last resort for patients who have tried other therapies and are still looking for improvement. So this always happens in melasma, that one therapy doesn't work for everybody and we might need to keep changing the therapy to give a good result in one patient.
Because like we said, it's a multifactorial disease, and in some patients it could be just due to increase in pigmentation. For some patients it could be pigmentation plus increase in vascularity. So we have to treat melasma accordingly. So what are the typical side effects you've seen in patients taking topical or procedural treatment for melasma?
So sometimes the patients can become over enthusiastic with the amount of medicines that they apply, and always ask your doctor what is the quantity of medicine you need and whether you need to apply it on the whole face or just the patch of melasma. Because these are strong medicines, because melasma is a resistant condition, and if you over apply you can develop redness, skin irritation, even peeling.
So the outcome of melasma treatment is usually very gratifying. But once a melasma patient, always a melasma patient. So it is a problem that can come back. So it is very important that you follow strict maintenance as given by your dermatologist.
Quite often I have seen patients take similar kind of therapy that I might prescribe from a different doctor, and they keep switching doctors. And this is often where patients of melasma fail to treat themselves. It is important that you stick to your doctor and talk to them about maintenance treatment, because melasma is a very chronic condition.
Also, if you go to one doctor, they'll give you the treatment, and if it does not work out, they can go to the next step. So, and if you go to another doctor, you change your doctor, then that doctor will start right from the beginning. So that can actually lead to more frustration and poor results.
So all in all, melasma is a condition that doesn't affect your skin as much as it affects your mental health. So it is important that you take your treatment and relax about your skin condition. Remember that it is prevention that is better than cure, and you must stick to your sunscreens, which is prescribed by your doctor, and use them day in, day out.
I hope you have enjoyed this video. If you have any comments or any questions, you can leave in the comment section below.
You can also let us know what would you like to watch next, so we can try preparing something on that.
This is Dr. Ankur Sarin,
Dr. Jushya Bhatia Sarin,
signing off now.